stay a safe place. Nonprofits, counties, or local responders also have the ability to set up similar hotel rooms and should work with FEMA for congregate sheltering authorization. If they are interested in setting up this housing for their workforce, they should contact their local or county office of emergency management. Now for today's report. As the hospitals reported last night, 7,594 hospitalizations, 400 of them should have been reported the day before. So we really have seen a flattening out of the hospitalizations. This is basically flat, and it has been for the last 3 days. There are 1,930 individuals in critical care, and 1,501 of them, of those individuals, are on ventilators. That's 78%. As I reminded you yesterday, we've been as high as 97% just a week ago. This is the lowest percentage of patients on ventilators that we have had for quite some time. Last night, there were 9 hospitals on what we call divert. Most of them on critical care divert. 5 of those hospitals on divert were from the central region. That's the first time we have had central region hospitals more on divert than the northern region. And as we have shared, we are seeing the increase in COVID-19 individuals and persons under investigation. We've seen that increase come from the north, and it is now hitting central, and most of the critical care beds in the central region right now are full. There are 432 long-term care facilities in the state reporting COVID-19 cases. That's either long-term care facilities or assisted living facilities. They report a total of 11,527 cases. 2,048 deaths have occurred in these facilities related to COVID-19. As you know, yesterday we posted a line listing of COVID-positive cases at long-term care facilities and assisted living and developmentally disabled congregate homes. This data is self-reported by the facilities, and some facilities today informed us that the data needs to be reconciled with their current information, that they have seen some gaps. So we're working with them and will provide updates on a regular basis. However, the basic direction of COVID-positive patients or residents and COVID-positive deaths are the same. There's just too many of them. Additionally, as reported over the weekend, 21 facilities were reviewed by our survey staff for staffing adequacy, the availability of PPE, and their infection control procedures. According to data reported this morning, of the labs that are reporting to us on their positive COVID-19 results, 167,233 tests have been performed on individuals, with 74,884 returning positive, for a positivity rate of 44.75%. That has stayed stable at 44% for quite some time. This completes my daily report, but I want to share some national data on increasing calls to poison control centers. The hotlines are reporting that there's been a 20% increase in calls related to exposures from household cleaning products and disinfectants. We know we have been encouraging everyone to clean frequently touched surfaces, but it's important to do so safely. CDC's COVID-19 website, cdc.gov/coronavirus/2019-NCOV, has information on how to clean your home safely. For example, you should wear disposable gloves to clean and disinfect. Use EPA-registered household disinfectants, and ensure proper ventilation when cleaning. Follow the instructions on the label to ensure safe and effective use of these products to protect your health. As always, I thank you for staying home and maintaining social distancing. Stand in social solidarity with all of us. Stay connected, stay safe, stay healthy. Stay doing what you are doing to do your part to save lives in New Jersey. Thank you.
Judy, thank you. May I give you a couple of follow-ups, if that's okay? First of all, counties, which I've read out just in terms of positive cases, it's the same 6 which dominate, but let's remind everybody there are many cases in every county, and there are fatalities in every county. But the top 6 in terms of positives continue to be Bergen, followed by now Hudson, Essex, Union, Passaic, and Middlesex. You mentioned the central hospitals on divert, and I want folks to know we were not on a random walk in terms of where we worked with the Army Corps in terms of opening these field medical stations. And I want to give Judy and her team and Pat and his and our federal colleagues a big shout out. We expected this. And therefore the sequencing of Secaucus to Edison to Atlantic City is something that was not by accident, shall we put it that way. There are always bad apples. I'm not sure I know how many of them there are. We're gonna know at the end of the day. But with all due respect to, and Judy and I were in violent agreement on this as we discussed this earlier, with all due respect to the long-term care operators who are disputing the data, with all due respect, the data is largely, as Judy said, I want to reiterate this, whether we're off here or there by a number or two, and let's never let this become abstract. These are humans. The overwhelming reality is there are far too many people who are dying in these facilities, period. And the standards and the protocols, the unevenness is incredibly disappointing. I know for Judy it is for me and for the rest of us. You didn't mention the racial, the underlying conditions look like they've stayed about the same. Would you mind hitting?
Sure.
Just because that's also been about the same, but it's worth repeating if you don't mind.
Certainly. On the 3,564 deaths that we have complete information on, 49.9% are white, 22.2% black, 16.6% Hispanic, 5.5% Asian non-Hispanic, and 5.8% other non-Hispanic. I also have the breakdown of 29,739 individuals who have been tested and have returned as a positive test. 35% are white, 21.1% are black, 28.6% Hispanic, 5.1% Asian, and 10.2% other.
So this is thank you. You took the words out of my mouth. So we have been saying, I think consistently for now a couple of weeks, the African American representation among fatalities is about 50% higher than the representation in the state's population. That the Hispanic representation among fatalities, has been slightly lower, just a point or two lower than the overall representation. But you took the words out of my mouth. That the African American testing number is about positive testing. These are right. Is about consistent with fatalities, but the Hispanic number is meaningfully higher as it relates to positive results. So that's something that I know you and the team are going to stay on. That is the first data point that we've had that is somewhat consistent with some of the reality that our brothers and sisters are dealing with in New York City. Judy, anything on veterans' homes? Do you want to hit that? Or
yeah, I do. Let me find it.
Just because I mentioned that we've tested everyone in Paramus, I want to again thank the VA who are surging in this week in both Menlo Park and Paramus, and ultimately they're there if we need them. Thank God we haven't, and hope it stays that way in Vineland.
Menlo Park Veterans Home, which with a overall census of 226, reports total residents confirmed positive 60, pending 5, total hospitalized 26, total resident COVID-19 deaths 29. And they also report staff have tested positive, 36 staff members out of 445. In Paramus, 239 is today's census, and confirmed positive COVID residents are 119. They report 46 resident deaths associated with COVID-19, and 51 staff of 394 tested positive. Vineland remains a census of 282. They have one positive COVID-19 patient and no deaths.
God bless them, and let's hope Vineland stays as it is, and God bless our veterans who we've lost. And it's also, they've got some staff positives, but thank God no fatalities among staff in any of the three homes. So thank you, Judy, and thank you for everything in your team as well. Pat, anything, could you, on compliance, PPE, infrastructure, as you wish. Thank you.
Yes, sir. Thanks, Governor. With regards to overnight, Newark police issued 18 EO violations and closed one business. In Monmouth Township, Gloucester County, a trooper made a motor vehicle stop for a motorist driving erratically. The subject was found to have several active warrants, resisted arrest, ultimately spit in the trooper's face upon being placed under arrest, and was charged with aggravated assault, resisting, and obstruction. At Edna Mahan Correctional Facility up in Hunterdon County, an inmate was intentionally and forcefully coughing and trying to spit on corrections officers. She was charged with terroristic threats, aggravated assault, endangering another, and throwing bodily fluid. Patterson, across 3 different events, 10 people were cited for the EO violations. In Passaic, 3 subjects were cited for being out for no reason, driving in an unsafe manner in Patterson. In Dover, a barbershop owner was cited for having his business open. In Lakewood, police responded to 8 kids that were playing in the gym and cited the owner for a violation. Also in Lakewood at the Monmouth Medical Center, an irate patient pulled the fire alarm and proceeded to cause over $2,000 worth of damage, and was charged with causing false public alarm and causing damage to property. Just on the heels of the visit to Atlantic City's medical station today, I think one entity that we've not maybe appropriately recognized has been the members from the Department of Corrections under Commissioner Hicks. They have been phenomenal every step of the way on our incident management team, all at Secaucus, Edison, now Atlantic City. Lieutenant Clay McLean, who I've known for several years, is just a phenomenal partner with us, and I wanted to make sure that we gave them the proper thanks and gratitude for their assistance in supporting our efforts. And lastly, just because I know, as the governor said, we're a month in, and the mental health aspects of this are a daily grind for many. And I just wanted to remind people of the number that Department of Human Services set up under the NJ Mental Health Cares hotline, which is 866-202-HELP, which is 866-202-4357. They have trained specialists on call on those phones from 8 to 8 p.m. And I would certainly recommend that if anybody's struggling with the depression or anxiety because of this virus, that you take the time to call those specialists to walk you through any of the issues you might be having. Thanks, Gov.
Colonel, thank you. And it's a good reminder. We're going to start over here, Brendan. It's a good reminder that